When counseling patients on treatment options for localized prostate cancer, clinical features tell only part of the story. Cancer genomic testing opens a window into the biologic potential of the tumor, helping physicians and their patients make more informed choices. The Oncotype DX GPS Assay is made for patients with localized prostate cancer. For the low and intermediate risk patient, their specific report provides actionable information on tumor aggressiveness to help inform the critical decision between active surveillance and immediate treatment with curative intent. For the high-risk localized prostate cancer patient, for whom active surveillance is typically not an option, their specific report provides information on the prognosis for adverse outcomes to help inform decisions about treatment intensity. Since the clinical decision-making in localized disease is different for lower and higher risk prostate cancer patients, we have different reports for each. We are now going to discuss the redesigned low-risk report for the GPS test. The low-risk GPS report is for all clinically low-risk prostate cancer patients who in the NCCN classification would be in very low, low, and favorable intermediate risk groups. This redesigned clinically low-risk report enhances the visual representation of information to facilitate shared decision-making with your patients. The Oncotype DX GPS Assay and the information that it provides for you and your patients is still all there, but based on your feedback, we've improved the visual design to make it easier to focus on the key data to enhance shared clinical decision-making. The results, from top to bottom, are oriented in logical progression. We start with what you already know. The key clinical information that you provided to us is at the top of the report. Next is the new information we are providing you. The numeric genomic score ranging from 0 to 100, with higher numbers indicating a more aggressive tumor. This GPS result is put into context visually with the distribution curve of other patients of same clinical risk. If the score is left of the middle line, the risk is lower than expected from clinical features alone. If the score is to the right, the risk is higher. This visual aids in the conversation with patients as they want to understand how their prognosis may have changed based on having the GPS test done. The GPS result independently provides information on tumor biology. Now, armed with that genomic score, we integrate the patient's other clinical information to get enhanced prognostic information. Why ignore all the key clinical factors that we know impact pre-test probabilities? It's like getting a PSA value and ignoring the patient's age, gland size, and whether they're on finasteride. This report starts with risk of adverse pathology at time of radical prostatectomy. We know low-risk patients are often upstaged at time of prostatectomy. Now, you can see the risk that the patient has bad biology, whether upstaged Gleason grade or non-organ confined disease that's not reflected in their biopsy, pathology, and clinical presentation. Finally, we list the individual percentage risk of high-grade disease, risk of PT3A or higher, risk of metastasis at 10 years, and risk of prostate-specific mortality at 10 years, all post-radical prostatectomy. We are the only commercial assay that provides all these endpoints. For some patients, all they might want to know is the risk of dying from prostate cancer. Others want more detailed information to make an informed treatment choice, and these numbers are clearly printed on the second page. In summary, the Oncotype DX GPS Assay is the same test you've trusted and relied on all these years, but now, for your clinically lower risk patients, the report will hopefully make it easier to have an informed discussion with your patients when deciding between active surveillance or immediate treatment. leading to greater patient confidence in their choice and hopefully minimizing decisional regret.